State capability enhancement project framework has been developed locally by getting inspiration from the concepts of adaptive leadership and problem-driven iterative adaptation approach. These are the concepts developed by the Harvard Kennedy School of Government. We started using these concepts, and we also added to this concept for solving complex developmental problems. So it's a kind of a government innovation framework, I would say, that would actually give the space for the public servants to experiment and to learn to solve the complex developmental problems. While doing so, it also actually builds that mission-driven approach. A state capability framework has 5 pillars. Basically, these 5 pillars are again developed while solving the complex developmental problems like reducing maternal deaths in the state. So the first pillar is actually building local leadership for problem solving. So often in the government, people look at for solutions from the authorizer, or essentially they look at the senior state leadership for solving problems. But the people who are closer to the problem are the frontline officials. So the approach is that how actually we are really giving that space, giving that autonomy for the frontline officials to experiment and solve the problems. So to do that, they require a lot of space, a lot of autonomy, and that is being given, and they are nurtured in the process to solve the complex developmental problems. Then the second pillar is how actually we are building the citizen-state relationship. So one of the important aspect is that how actually the communities, the people are actually trusting the government interventions, especially in this case, how the people are trusting the health systems. Consciously, we have built a framework how actually we can involve the communities. So whether through by organizing them into community institutions like village health councils, or leveraging the existing women self-help groups, and also making sure that like the state leadership, especially the officials at the district level, state officials visit the communities, interact with them, understand the problems. In fact, for the purpose of maternal mortality reduction, what we have done was we started actually doing this maternal death reviews along with the communities. In the process, the community will actually learn, what has happened, how actually they can prevent the future deaths. The third pillar of state capability enhancement framework is effective use of data and research. Like, we often, use the frontline officials and workers to collect the data, but often, we are actually not capacitating them to use the data to solve the problems. So we understood this problem. Similarly, we also understood the problem that there is a lot of research that shows that if kangaroo mother care is one practice can save, lives of newborns. So, but that research has not been taken very effectively to the communities. So we understood the importance of effective use of both, the data that what we are collecting, like the data that we collect about high-risk pregnant mothers. If that information is available not only with the medical officer, but also with the village health council, but also with the BDO. So all of them can come together and make sure that that mother is saved. So that is what is happening. So we have locally, in fact, we have developed that kind of a data systems at the state level. We call it the Mother Data Portal, which is an open data health portal. And using that one today, everyone like a medical officer, the CDPO, the BDO, everyone knows that where is high-risk pregnant mothers. How actually they have to take steps to save that mother, to make sure that the mother actually provides, proper care. This is one principle that we want to, see that like it's important for achieving the results that we wanted to achieve. Especially we wanted to achieve transformative results. To achieve transformative results, you need to be very, very agile, and you need to have a very real-time information, and you need to act very quickly and swiftly. So that is what is happening through the state capability enhancement framework. The fourth pillar of state capability framework is addressing systemic challenges. what are the systemic challenges? So I'll give an example about the maternal mortality and reduction in the state, the efforts. So initially, when we have this highest maternal mortality rates, we have one of those highest maternal mortality rates in the state. The default explanation was that we don't have enough specialist doctors to save the mothers. Yes, that is one reason. But that is not the only reason. You try to find the source of the problem, not just symptom of the problem. When we started actually identifying the root causes of the problem, we found the one of the main systemic barrier are the reason. There was no right to birth spacing is observed. So there is no in fact most of the maternal deaths, when we have analyzed, 85% of maternal deaths, when we observed, they do not have the spacing between one child to another. The required spacing, medically required spacing, that is about 1,000 days. So we understood the problem. The problem is that the women actually, in a matrilineal society, women actually started taking a role that taking care of home, raising children is the responsibility of women, and public affairs is the responsibility of the men. So this we wanted to actually address this problem. So we started actually bringing in fact the state has brought women's reservation in the village employment councils to ensure that there is a significant participation of women in the public affairs. Similarly, we started actually mobilizing a lot of the self-help groups and involving them in a lot of public programs that help in especially talking about these sensitive issues, so that they can overcome this systemic and structural barrier. So we need to remove them to facilitate the transformative development. To achieve the transformational development, we need to identify what are the systemic challenges, what are the systemic problems, and we need to actually bring the necessary political supportability to bring those policies. So now I come to the fifth pillar, which is a very important pillar, building political supportability. So any such systemic changes are to bring that to sustain these efforts through policy, and through investments and the prioritization of these issues can happen only if we build the political supportability. So often this required to be cultivated. So what we have done in this, in fact, in the state was that we started while we are addressing this problem of changing or improving the health indicators significantly. So what we started doing is that we started actually sharing this information with the political leadership, especially with the chief minister and the cabinet minister, explaining about where we stand, telling about the data, what it shows, how actually these issues require, a larger support, policy support to change that we wanted to see. So while doing it, what we have done was we started actually showing those small wins. Okay, we were lowest in the child immunization in the country. So when we worked on that one in 7-8 months, we have shown that we have gone to the number 2 rank in the country. That gave a sense of purpose among the political leadership. They felt that we can actually solve the problem. So they started investing more on this particular idea. So we brought in new programs like Chief Minister's Safe Motherhood Scheme, in addition to the National Health Mission, to support the pregnant mothers, and to provide that autonomy to the medical officers to take decisions to support the mothers and children. So building the political supportability is a very, very important pillar. How actually the government can become an agency to bring transformative development. So that was the idea, that has been brought in through this state capability enhancement experiment that what we have been doing. Today, the state government, by looking at the results and, looking at this approach, we have institutionalized this entire project into an institution, which is now called Government Innovation Lab. So, and the Government Innovation Lab is now working for other sectors too. Not only for the health sector or addressing some of these complex challenges of the state. But, when it comes to the challenges, while implementing this program, one of the challenges that still that I think I would say is that ensuring that interdepartmental collaboration, which is So it's something that we need to work on constantly. To build that sense of purpose among everybody, and also that can happen if you sustain the political supportability. So it's very important that we need to continue to sustain the political supportability, and if we do that, when we can actually build that sense of purpose. So this is a kind of a tool that actually I would say a framework that we have developed in the state, and we are seeing that if any complex problem, if we can actually use this kind of a purpose driven framework, we can achieve the results that we wanted to achieve.